Now to NBC5 Responds. This week, we're taking a deeper dive into health insurance denials, some of the creative solutions that many are using to get their medical treatments approved.
When a Wheaton woman's cancer treatment was denied days before it was supposed to start, her desperate post for help gained her an unexpected ally. PJ Randhawa explains.
At the start of 2024, 35-year-old Jessica Wozniak lived a very family-focused life with her husband and young daughter in Wheaton.
Just chasing after a toddler, really, most of the time.
But in early 2024, what she thought was a simple stomach flu turned out to be a medical emergency.
It just really turns your life upside down.
To protect her immune system, Jessica shared her story with us virtually. It all began with a surprise diagnosis in June 2024.
I was told, you have stage 4 colon cancer because it has spread from your colon to your liver.
Because part of her condition was genetic, she was given immunotherapy treatments, but that treatment alone wasn't enough.
Essentially, I was told that the immunotherapy was working to shrink the spots in my liver, but the doctors were concerned that my primary mass in my colon, one of them, was actually growing. Despite the immunotherapy.
So late last year, she says her doctors recommended combining the treatment with chemotherapy.
They thought adding chemo would give me the best chance to shrink the size of the primary tumor in my pelvic area.
But just 2 days before her combined treatment was scheduled to begin, bad news from Cigna, her insurance company.
My doctor was denied both in a pre-authorization and in a peer-to-peer and told the immunotherapy isn't working, and so therefore you shouldn't continue that. We'll approve and pay for chemo, but not immunotherapy. I was like, no, I know things are getting worse without having treatment, so what can I do?
Jessica says it felt like Cigna had put a price tag on her recovery, and it was more than it was willing to cover.
I thought, absolutely not. Who is this person at an insurance company deciding if I'm going to live or die?
That's when Jessica, a public relations professional, posted this plea for help on LinkedIn. She says she got a tip that would change everything.
What I was told from some people was that if you are on a healthcare plan, an insurance plan paid for by your employer, that your employer's benefits team, HR, has some say on the decision making that goes into these authorizations.
Rather than going through Cigna's formal appeal process, Jessica says her company's HR team immediately began making calls on her behalf. And to her surprise, the day after her treatment was denied, there was news.
When my husband came in, handed me the phone, and she said, okay, you're authorized for treatment on Wednesday.
Were you surprised that they held this kind of, power or sway, advocacy?
I had no idea that HR was so powerful in this process.
Jessica's now completed her 3rd round of combined therapies. She says she's slated for at least another 2 rounds as her doctors prepare her for surgery.
If there's one thing I learned through all of this, it's that you are your own biggest advocate. No one will do it for you. So keep pushing. If you feel like something's not right, something can be different, something should be more, tell your doctors.
A Cigna spokesperson tells us it re-reviewed Jessica's claim after her HR team got involved, and it approved it within 24 hours. It also says there are multiple levels of appeals patients can request, including a review by an independent third party. And if your physician requests an expedited review, Cigna will complete it within 72 hours or less. PJ Randhawa, NBC5 Responds.
We wish Jessica all the best. PJ, thanks for such great information there.